welcome to this this webinar. I recognise quite a lot of the names and faces that are here, but for those of you who don't know me, my name's Russell Cartwright. I'm Assistant Director of Communications in South East London, and I've worked in the NHS comms for the last 23 years. I'm also a behaviour change specialist, having learnt a lot about using behavioural science for impactful communications in the last 5 years or so. And I'm currently working as a consultant to share that passion really with other in-house teams and to help them incorporate behavioural science into their ways of working. I set up this public health communications hub with the support of Can Digital as a place for those of us working in the field to come together, to solve common problems, to share learning, good practice. And these webinars are one of the things that we're doing for as part of the hub. This is the fourth one we've done, and you can see recordings from the previous ones. And as just mentioned, we are recording today's session. The good news is that membership of the hub continues to grow. We're up to nearly 150 now. So a really big welcome to any new members, people who've just signed up. We're really keen that what we cover in sessions like these and the topics that we cover are useful to you. So if you've got any ideas for future topics or any suggestions, please do put them in the chat and we'll respond to them. In fact, the topic we're covering today was one that in one of the earlier webinars was voted for by participants. So, do please let us know if you've got any ideas. Also, if you've got any questions for any of our speakers today, again, please put them in the chat and we'll take as many of them as we can at the end of the session. So for today's session, we're focusing on adult mental health, well-being and stigma, topics which are very close to my heart. And I've worked previously in a mental health trust for more than 12 years. And I'm really delighted today that we're joined by an excellent speaker, Sue Baker. I first met Sue around 15 years ago when she was just starting to work on the Time to Change campaign. Since then, Sue's been awarded an OBE for her services to mental health as a result, really, of the impact that Time to Change has had, changing the way that people think about, talk about, and react to mental ill health and mental well-being. So Sue, would you like to introduce yourself?
Yes, thanks, Russell, and thank you for people for asking for this topic. It's an absolute pleasure to be with you today. I won't ramble on, but as Russell said, I was the founding director of the Time to Change anti-stigma, anti-discrimination programme in England that ran for 15 years and closed about 3 years ago. But in the last couple of years of that programme, I had the great pleasure of being able to adapt methodologies with amazing NGO partners and people with lived experience in Africa and India as part of a global programme. And since then, and actually probably all the way since Time to Change, I've always felt like a global citizen. We borrowed the evidence base from Scotland and New Zealand to structure the first programme in England called Time to Change. So, there's lots of learnings to be had within ourselves in England and globally as well. So I work globally on stigma and discrimination and behaviour change campaigns, particularly around mental health, sometimes other issues. I think I have a colleague from Lithuania, because I've been working with the Ministry of Health, training people and setting up the stigma programme with colleagues in Lithuania. I think she's joined, actually, Gintare. So this is a global problem, but obviously what we're focusing on now is what can we do about it with the resources that we have and in a very different context to how things felt 3 or 4 years ago. Thank you for having me.
Thanks, Sue. And we're also joined today by John Paul Danon from one of the founders of Can Digital. Can are a great agency whose ethos is all about supporting those of us working in the public sector and working together to find cost-effective solutions. John Paul, would you like to introduce yourself?
Hello, yes, John Paul co-founded Can about 10 years ago, and we worked a lot in the public health space to help nudge all sorts of behaviour, from smoking cessation to vaccination uptake, and also many mental health campaigns. And our ambition is to get more for less with your smaller budgets to achieve a lot more measurable outcomes. And I'll be sharing one such campaign a little bit later on. Thank you, Russell.
Did you also want to talk about the poll, John Paul?
It's an excellent prompt. Thank you, Russell.
Yes.
So you will notice in the chat there is a poll that's just launched. And we just want to get a bit of a view on all the people in the call today. What are the main challenges around mental health where you are? What are the main drivers of poor mental health? Is it things to do with cost of living, for example? And if you could just pop your answers in there, we'll build a word cloud and come back to it a little bit later on. But it'd be great, yeah, if you just take part and start to put a couple of answers in there, and we'll be back to it in a little bit.
Thanks, John Paul. I'm going to hand over to Sue now for her presentation.
Thank you. So what we thought we could do in the next sort of 15 minutes, and it is going to be a canter through. I'm sorry this can't be done more at a kind of reasonable pace, but you know, I could be here talking about time to change and mental health stigma and how to address it in England and around the world forever. So I'm going to try and just cover as much as I can, but please put questions in the chat. I know there's a lot I can't cover. There's a lot I haven't applied to each local context in England, but I hope we get a chance to talk about that later. So the consultancy that I have, well, I'm a freelance consultant. I run Changing Minds globally, and I work with ministries, NGOs, funders, mental health services, and public health teams around the world to set up evidence-based anti-stigma, anti-discrimination programmes with people with lived experience central to that, and I will keep saying that as well. I'm just going to flick on. Thank you, John Paul, for doing the awful job of the technological side. So as I said, obviously Time to Change closed after nearly 15 years in 2021. The government at the time wouldn't fund a fourth phase of our work or the global work either, despite some lots of great impact and promising, very promising plans for the future for both those programmes. I won't get into all the politics of that. But things have very significantly changed. I mean, the programme closed as COVID was hitting, and you know, so much more has happened since then. And around the world, and obviously here in the UK and England, a very significant increase in the prevalence of mental health problems and a very big burden felt by children and young people in particular, and not being able to access help as and when they need it. I won't go into all my campaigning advocacy mode after nearly 30 years at mine, so I'll move on. Cost of living crisis has already been mentioned, obviously severely and seriously compounding the determinants of mental health and well-being. The scale of inequity, you know, another horror story of our times. And obviously these programmes are about those of us with mental health problems facing severe exclusion and discrimination, and that has multiple layers, as we all know, across a very vast range of types of discrimination. Lack of political will. There was a big review commissioned into the Mental Health Act, but it's not gone any further. People are very frustrated about that. We have a very outdated piece of key legislation in our country, and there are calls for that to be prioritised. Probably not by this government, but hopefully by whoever else is here come the election. Anyway, Time to Change did have a planned fourth programme of work. We didn't think all the work was done on stigma and discrimination, but we spent a year in research to find out what needed to happen next and who hadn't really felt the benefit of this big social change that many of us had started to witness and witnessed over a long period of time. And the research was telling us, research with people with lived experience in particular, from all kinds of communities across England, that some people seem to be facing higher levels of stigma and discrimination and possibly haven't felt the benefit of others. We never took a kind of diagnostic approach. We wanted all of us with lived experience to benefit from reductions in stigma and discrimination. But what we found was that people with certain diagnoses were experiencing higher levels and more kind of entrenched discrimination and stigma, people with schizophrenia, bipolar, personality disorder. And we also wanted to have a focus on inequity and look at people living on you know, the lowest means and incomes and most marginalised and excluded groups. And that would have been our very much more sort of pincer movement targeted focus. And gosh, as we just said, that could have been really helpful right now, but Time to Change wasn't funded anymore. I have to say, many people on this call might have been involved in and still involved with the local Time to Change hubs, as they were called, which was about embedding smaller movements, anti-stigma movements, but very powerfully within local communities, public health teams, local authorities, mental health services. The list goes on. NGOs, people with lived experience, employers and schools, was the idea of these kind of clusters like hubs. And many of those mini movements have carried on, which is fantastic, you know, news to me and warms my heart. So the reason, just going back, why stigma and discrimination? Well, I argue, and I'm putting together a script at the moment, I can't tell you why, but all of the myths about why not to do stigma or the barriers, one of the things is that it's kind of just this woolly kind of sideshow and it's not really going to impact people's lives. But what we said and what we found was it's the big umbrella under which there's allocation of resource. You can't do mental health promotion and prevention unless people are willing to think about their own mental health and take action. There's a lot of stigma still around, you know, looking after your own mental health and seeking help. It supports early intervention and sustained recovery. If people do get treatment for their mental health problems, what's going to happen if you can't get a job, you can't get a partner, you know, your friends and family aren't supportive. So it is about sustaining the gains made in recovery and maintaining recovery. Service transformation, policy and legal reforms. I won't go on, but for us, the big umbrella was always that there was this big cloud, this big shadow over mental health, and we had to do something about that. There is a huge amount of evidence now about what is the most evidence-based approach and the most effective approaches around all global regions to tackle mental health stigma. These slides will be made available, and obviously there's this recording, so I won't read it word for word, we haven't got time. But basically it was a review done by Sir Graham Thornycroft at King's College London and Charlene Sunkel, who's the founder and chief exec of the Global Mental Health Peer Network. They reviewed the review group reviewed over 20 years worth of published academic peer-reviewed journals on stigma. 216 were then selected and reviewed. And there was also a survey of nearly 400 people with lived experience across every global region. And some of the key findings, so the three I just wanted to highlight, were that stigma and discrimination contravene our basic human rights and have severe toxic effects that can exacerbate marginalisation and social inclusion, and I would add, and therefore mental health problems and our ability to recover and maintain our mental health and well-being. Reduces our access to employment, physical and mental health care, and education. So all of our human rights are compromised. However, the most effective evidence-based approach to address mental health stigma is social contact. And if you want to hear more about that, I'm sure I can send you papers, but actually it's as simple as, well, it's not simple, it has to be very well planned, safe and effective disclosure where those of us with lived experience are purposefully having open conversations about mental health and sharing our lived experience in a very structured, methodical way with the general public. I could talk about this, but this is one of the core approaches that get adapted around global regions in the work that I have the pleasure of doing at the moment. So the final thing is that in a survey of those nearly 400 people around the world, a very similar finding was found from a survey we did of people supporting Time to Change at the start of the programme. And nearly, well, over 2/3, 70% said that stigma and discrimination can be worse than the impact of the mental health problem itself. So there shouldn't be any question about why address mental health stigma and discrimination. So moving on, John Paul, because I've laboured a bit on that one. The Lancet Commission also very helpfully kind of conceptualised these three definitions of stigma. And I'll just quickly whip through this. Self-stigma, where we internalise it with multiple implications. Stigma by association, so it attaches itself to our family, our friends, people working in the profession, for example. A lot of us know about that as well. Public stigma, when it comes from what other people say, from the media, from, you know, from culture and society at large, from faith leaders, structural discrimination, so where it's in policies and practices and policy and legal frameworks as well. So it's interesting to think about these 3 types of stigma, which really you're also talking about discrimination within this as well. So moving on. So just a quick flick through Time to Change. Now, some of you will have seen it and heard of it, some of you won't. Some of you might not have been around in our sector or might be too young to remember it. So just a quick refresh. We ran for 15 years. Our outcomes, well, let me just talk about the impact of stigma. The vast majority of people using mental health services experience mental health discrimination. That was from a survey done by the IOPPN at King's. Again, this is the finding of almost 2/3 of people saying that stigma can be as bad, if not worse, than the symptoms of mental health problems. So you can't just treat the mental health problem and think that everybody's going to be okay. And about a quarter wanted to give up on life. Now, every 40 seconds somewhere in the world takes their life. I mean, that is a devastating statistic. I know a lot of you are involved in suicide prevention work. We might get a chance to talk about that later. Just moving on. So our outcomes were to improve public attitudes and behaviour, reduce discrimination. We've been talking a lot about discrimination. We looked at 19 areas of life for that measure. Empower those of us with mental health problems to build the skills to take action against stigma, and more importantly, to create a sustainable campaign. So I'm just going to ping on quite quickly. You don't need to know all the details, but it's all on there if you want to look at it. We had big national projects, and we had regional coordinators, and then we had usually grant funded activity, and then that became Time to Change hubs, which many public health teams and local authorities and mental health trusts became partners in. Also, I'm just going to flip back. So we had the big campaign, which was all about tailoring material, as well as national reach and impact was tailoring resources so people could localize them. And that's, oh gosh, we were a movement. You have to provide evidence-based tools and provide materials with consistent messaging. Because in mental health, before Time to Change, I'm not saying we were everything. Lots of other people ran amazing campaigns alongside us as well. And more people as we started to move on stigma. But the public were so confused about mental health. There were too many mixed messages, and we needed one consistent set of evidence-based messages that had impact. I won't bang on about that, but you'll know that challenge. Thousands of people trained and supported to share their lived experience via this social contact methodology. And we trained people in a thing called Story Camp to vlog, blog, use social media. We started Time to Change when there were no social media companies or platforms, which is hard to imagine in 2007. But wow, did that become a powerful tool for us? I mean, it can be used for good. It's not all awful. The community leadership hubs work with 2,000 schools, head teachers, parents, taking a whole school approach. And then the work with employers. You'll see a shiny forehead that you might recognise there. But we had all major political parties signed up to Time to Change. And that's the chocolate manufacturer, the Ford, who provided about 500,000 of advertising space and then did their own ad based on ours, a big partnership there. So one of the things I just want you to take away is the benefit of partnership in these movements to leverage your reach and your impact. So it's not all about handing money over, it's about the partnerships and bringing you together with a common outcome. I'm just going to move on here. All of our campaigns, all of the social marketing campaigns were always based, they were behaviour change campaigns. We went through a journey. They become much more focused on calls to action and behaviour change, but we had to go through a journey of a sort of unveiling, revealing understanding and knowledge around stigma, and that people were the stigmatizers, but they didn't realise it. They were subconscious stigmatizers. And then taking people through the kind of calls to action of talking more and then actually stepping in. And I'll show you some of those adverts in a minute. But everything was based on audience insight research. We had big surveys of people with lived experience. What do people want done about stigma and the messaging, and who do they want us to target? And lo and behold, wherever I work in the world, when we do that research with people with lived experience, it's family and friends that are the most common driver of stigma. They're the people that we expect to be able to lean on, but they don't know what to say or do. So often they're saying and doing the harmful things. So that's where we were at. Moving on, there's a huge amount more data here that I'm conscious of time. I'm going to have to flick through. So as I said, we were on a journey. People didn't know you could face discrimination and stigma because of mental health problems. People were unconscious of their role in that. They didn't think it was them. So we had to very gently allow people to reveal that, you know, to come to the realization that it was their behavior that we were talking about without ever saying that or pointing fingers. Then the push for talking, then the push to stand in for a friend. And we went to what we called the cold male audience. So the audience that hadn't seen as much change. And we also had another second primary audience of African and Caribbean communities because of all the statistics that we know about mental health, levels of sectioning and over medication and many other poor reports of treatment. So I'm going to move on. There was lots of research behind that aspect of our campaign as well. So obviously we needed to evolve the campaign over time as our audience came with us over time. You can see a famous face to the left. We did famous faces, everyday people like us, and myths and facts. We knew that a lot of people didn't mean the harm. They just didn't, nobody got taught anything at school or work, or there was no conversation around the kitchen table, if there is such a thing, about mental health. So people had all these myths, prevailing myths that had lasted for generations. Anyway, I'm going to move on. Thank you, John Paul. I know I'm very quickly flicking through just to show you a couple of ads, if that's okay. I'm nearly out of time. So this was the first primetime TV ad we did using humour. No, we don't seem to have the sound working there. Can you hear it? No.
You usually have to tick a box when you share to say include the sound.
Thank you very much. I'll leave that with them. Let's see if we can get that one.
How am I feeling?
Oh.
Yeah, pretty good.
That's working.
Good days and bad days, but yeah, I'm glad to be back at work. Cheers for asking.
No worries.
How are things with you?
Yeah, great. Can't complain.
Thanks, John Paul. I knew there was going to be a technical hitch, and
I'm sorry.
Don't worry. Oh my gosh, I'm glad it wasn't me. We can come back to that, but that's basically playing on that. You know that somebody's been off with depression. You know, they're a colleague of yours. You've worked with them for years, but oh my goodness me, they've come back to work. Don't mention it. Don't talk about it. Avoid it at all costs. So this was about how ridiculous is that? So we're playing on the insight we had about this fear of this conversation and just like, you know, how difficult can it be? So the theme of talking massively took off. I'm just going to show you another advert, which is later in the campaign. So we're kind of skipping many years forward. And this was one of our last, not quite last ads, aimed at the men that didn't think they knew anybody with a mental health problem. And they won't talk about mental health. So we had to take a totally different approach.
Whoa. Can I help you?
With John's mates. Is he around?
Yeah, he's over there.
Cheers, mate.
Right, John. All right, boys. What's it there?
1 in 4 of us will fight mental health problems this year.
You can do this, John. We're with you.
We're with you, mate.
Having a mate in your corner can make all the difference. So if your mate's acting differently, step in.
Here we go now, the bell's out.
Search.
So as you know, as communicators, we spent, this is the young people's version of the In Your Corner.
1 in 10 young people will experience a mental health
Obviously
problem
higher
this
now.
year. If a mate's acting differently, be by their side. Twinkle, twinkle, little star, how I wonder what you are. Up above the world so high, like a diamond in the sky.
Okay, then just before we go on to the next one, so we had a young people's campaign and we had the adult male campaign, and at certain demographics we were very targeted. We spent a year in research with young people, with their parents, with men and with women and with boys, and we decided to go for the male audience with, they thought, no proximity to mental health. It hadn't happened to them. It hadn't happened to a friend. They didn't know anyone. So they had absolutely no motivation for engaging in the mental health campaign. They wouldn't talk about mental health. So we had to do the Trojan horse of getting around the topic by asking them to be there for a mate, because friendship mattered. massively mattered to be considered a good friend if someone was in trouble or need, and the same with young boys as well. To be considered, friendship really mattered. So that's why we took that approach. We had the best behaviour change results of people that stood in for a friend and asked them how they were, or checked in on them, is I think the language we used. But then this final ad was even more powerful. Something like 80%, I think, I'll check that stat, of men who watched this ad, who were campaign aware, were actually said that they'd done this action, asked twice. So here's the final ad from Time to Change.
Yeah, I'm fine.
Sometimes people say they're fine when they're not, but with 1 in 4 experiencing a mental health problem, to really find out, ask twice.
You sure you're all right?
Actually, I could do with some help.
Well, let's talk about it.
Yeah, do you mind?
Okay, simple call to action. You know, that was after about 13 years of the campaign. So I'm just going to whip through a couple of others because I'm way over. This is the impact of Time to Change. The evaluation, the first 2 from the Institute of Psychiatry, Psychology and Neuroscience at King's College London. The improvement in public attitudes of 12.7%. You know, that's not us, that was our movement. But yes, we were kind of, I talk about us, the snowplow at the front, but so many of your organisations got behind it too. Real decreases in discrimination reported by those people using mental health services across 5 mental health trusts in England. That, for me, is the litmus test. Did people face less discrimination? Had behaviour changed? I'm just going to ping on. Champions feeling more empowered. And, you know, this is no linear, you know, straightforward curve, and you have to hold your nerve. I'm not the most patient person, but you can see how long it took to actually start to achieve real change. And these things are the work of a generation. That's what we said at the start, and we continue to say that. Young people's attitudes, by the way, have shot up far more than anyone else's. The core methods: foundational research, audience insight, people lived experience, the trained and supported champions, social contact events, social marketing, and of course, thorough evaluation. And this core model is, I have the joy of working with colleagues, including one online, around the world, to adapt these methodologies led by local partners and working with local people with lived experience to drive change. And at the moment, I'm working in the Caribbean, in the BVI in Bermuda, Lithuania, been working in Ukraine before the war and continue to, in India and Africa as part of the Time to Change Global Programme, and Gibraltar, and I'm off to the Falkland Islands soon as well. So there are colleagues bottom middle in Lithuania. They've got an amazing campaign called Zvelgilau, Look Deeper. But anyway, you can see colleagues from Ghana and Kenya and India there in the BVI, 2 amazing champions. So just one final ping. I think there's a couple of slides to finish on. Let's not play. I think we'll flick that one, John. That was a film. Oh, yeah, that was a film from Ghana that just shows you how some of the parallels in terms of the myths and the facts. We won't play this one either. That's just a 1-minute film to celebrate the achievements of our movement, but I don't think there's time to play that, but hopefully you can watch all of those at your leisure. They're only a minute each. And that's me. Thank you very much for your time.
Thank you so much, Sue. Please do keep putting any questions into chat for Sue, and we will try and answer as many of them as we can. I mean, I think it's a shame we ran out of time a little bit there, because the results of the campaign were absolutely staggering. And I think I put in the marketing stuff for this seminar, but the Royal Society for Public Health ran a poll, and Time to Change campaign was in the top 20 of public health achievements in the 21st century. So, you know, alongside things like the smoking ban and, you know, real. So, you know, let's not underestimate all the massive achievements of such a brilliant campaign. I'd like to give you a very quick overview of a successful behavioural science-led campaign we did in South East London. I know there's a few colleagues on from South East London, so sorry if you've seen or heard some of this before. But prior to this campaign, so Free Your Mind was the campaign, and prior to it, I'd never. I mentioned earlier I've worked in NHS for a long time, and I've never run a campaign where we've had such an impact and such value for money as this campaign. And I learned a huge amount through working with a really great supplier, Lynn, on this. And it changed forever how I view campaigns. It developed my passion for behavioural science and nudge. So Free Your Mind was born early in the first lockdown in 2020. While everyone else was focused on responding to the immediate impacts of COVID, we recognised that the pandemic, lockdown, etc., was going to impact people. I had a conversation with our SRO for mental health, who wanted us to share some mental wellbeing tips early in the lockdown. And I wanted to do something a bit more than the usual kind of tick box comms, which had little impact. So I spoke to Lynn, I spoke to our SRO, and we developed a business case for the Free Your Mind campaign. The broad aims of the campaign were to encourage people to think about and take action for their mental well-being, promoting self-help resources, digital resources, and services which were still available but were working differently. So this slide shows our broad comms objectives, and awareness and reach is there. For me, this is, out of these three, this is the least important, but it is also where most campaigns focus and most campaigns are measured. For me, engagement is much more important, and most important of all is actions and people taking the actions that you're asking them to. Next slide, please. So I haven't got time to talk through the behavioural science approach and all of the research and insight work that we did, because that, in a way, is the unseen part of a good behaviour change campaign, and it's that effort that brings you your results. But we did desk research, we did consultation with our partners across 6 boroughs in South East London, and we identified 2 target behaviours, which are on the slide now. Next slide, please. So we did structured interviews, we surveyed our residents, then carried out a behavioural diagnosis to identify the main barriers that were stopping people from taking these target behaviours. So choice overload was a key one. Excessive choice creates pressures and stress. It can lead to people deferring the decision or not choosing at all, or making what they think are safe choices. And at that time, there was a huge amount of public health messaging. Some of it was conflicting, lots of it was conflicting. It was rapidly changing. So a key part of what we were trying to do was simplify the choice architecture. Status quo bias, people stick with what they know and what they're comfortable with. Confirmation bias, the way that social media works, people seek and receive information that confirms their existing biases. Conflict between willpower and desire. Something we all experience and something that's very common in public health and was very true here. And people were very reliant on following choices made by their peers. Next slide, please. So the next slide shows some of our, this slide shows some of our key campaign messages. And when you read these, they seem really, really obvious and really straightforward, but we wouldn't have got to these if we hadn't properly diagnosed the problem through a behavioural lens, and if we hadn't tested them. Next slide. So in terms of our creative development, we wanted this campaign to stand out from other NHS and public health messaging. We used a metaphor of leaving the darkness and entering the light to free your mind. And that was where the Free Your Mind came from. And it very much fitted into the landscape at that time. I'm not saying this would work like this now, but at that time, it really did have impact. We created a visual identity of powerful, relatable portraits of people half in the dark and half in the light to represent the point of seeking help or the point of taking action about their mental well-being. And we developed a suite of assets, which we tested scientifically and segmented by age. Next slide, please. So what we did, very briefly, we launched an 8-week campaign with 4 bursts of paid activity on Facebook, Instagram, Twitter, YouTube, and Google search. Running it in bursts enabled us to learn and adapt as we went. And then that was supplemented by organic content and linking in with local influencers. Next slide, please. We had good organic engagement by using influencers, particularly when they used our messaging on their channels. So there you can see a film from Judge Rinder, who I met at a vaccination centre and just persuaded him to record a quick film. But also on the right, you've got George Dobson, who is captain of Charlton Athletic, one of our local football teams in South East London. And we had excellent organic reach and engagement by recording a short video with him and the football club and the football club's community trust sharing it on their channels. Much greater engagement than we would have had through using our channels. We also had support from Millwall FC, Rio Ferdinand Foundation, and Rapman, which all got good reach. Next slide, please. So what we achieved, these are some of the headline results. We reached 1.5 million residents out of a population just under 2 million. Our engagement rate way surpassed their target, and actually on Facebook and Instagram, the engagement rate was 3.5 times the average for this kind of campaign. So we really smashed it in terms of engagement. There were more than 25,000 clicks on our ads. And for me, more importantly, 54% of the people who came to our microsite took one of our calls to action. So they took some action, they accessed self-help resources, they looked up services, that kind of thing. One completely unexpected result was a massive spike in referrals to IAPT, or talking therapy services. This increased by 135%. And you know, Sue was talking about inequity. We know that mental health and inequalities in mental health is a massive issue. So we were really pleased that 44% of our engagements were with people from ethnic minorities. And this compares with a South East London population of 39% of ethnic minorities. So we did really well there in terms of reaching and engaging with people. Next slide, please. I'll go through these really quickly because of time, but just you know, after a little while, our audience became saturated. So it was costing more to get clicks. So shorter bursts, maybe with refreshed assets, might have helped there. Search worked very well, but actually it would have worked better over a bigger geographic area. So if we teamed up with other regions, we probably would have had much better results. Community management was very time consuming. At the time, we were and needed to be handled sensitively. At the time, we were a small team. I was getting alerts on my phone and responding to most of the comments myself, to be honest. And you know, so do factor that in. We found reaching and engaging with 20 to 25-year-olds particularly hard, not an uncommon problem. Since then, I've used Snapchat for this audience and had much better results. Also, the key one, really, paid social is where most of our traffic came from. In my opinion, there's little point in doing a campaign just using organic posts. You know, the things have moved on since you would get good reach with organic posts, sadly. Last slide, please. So just a few takeaways to stress, you know, the importance of testing. Look beyond reach to evaluate your results. Actions are what are key. Track everything you can and analyze what people do. Bursts, run things in bursts and learn as you go. Influencers, especially football and other sports teams who will have big followers, and a lot of those followers will be in your local area. Take a risk. Don't pull an ad straight away if it's getting negative comments. Respond appropriately. You never know, it might end up getting the best engagement out of all of your campaign. It certainly was for us. Factor in some time to manage the community. Mental health is an emotive issue. And finally, use genuine behaviour change techniques. There are lots of people who, well, behaviour change is bandied around as a buzzword a lot, and lots of people don't do it properly. So, you know, do it properly and use proper techniques, really. So yeah, that's that. John Paul, did you want to reflect and bring in any questions?
Do indeed. Thank you so much. That was dense, full of information. Really appreciate it. And as was yours, Sue, as well. So many things that I've learned that I will take away. I think that one of the things that really struck me about Sue's presentation was the global nature and some of the correlations that there are across the world with stigma. Now, I just wanted to quickly look at the polls here and see if this works. So if we can review the results. I don't know if everyone's able to see in the chat, but cost of living has come up massively, and I think generally you're looking at challenges around service delivery, the service, you know, being under-resourced and being stretched, and so you've got this problem of probably demand going up and need going up and services being cut back. which is a huge challenge, and is something where communications are probably highly likely to be able to support people and nudge them in the right direction, as Russell was just showing. I wanted to go to Sue very quickly and ask a question. One thing that stood out for me, well, we're hearing from a lot of people, is that suicide prevention is a big priority. It's politically sensitive, it's got political attention, and then communications teams are being asked to address a very complicated problem with not very much resource. And I wondered if you could have any sort of your top 3 tips or a handful of tips for communicators that are trying to address that problem with little or no resource.
Yes, and thank you, Russell's just put up the Norwich City Football Club. I'm sure you all saw that ad. That was with the Samaritans, wasn't it? That partnership, which was incredible. Just another example of partnership. Like, leverage partners in your community for reach and impact. It's far more credible if somebody that other people respect and follow. I'm not saying people don't respect and follow public health teams' communications or mental health trust, but go to the people that, people will respect and trust their independence and their authenticity. There's no reason for them to share messaging other than that they believe it to be a good thing and you to be good organisations with good intentions. So have a look at the Norwich City one if you haven't. How much did that cost? It might have cost a bit of production to get a good video. That's exactly the kind of thing that we do. Yes, of course we had paid ads, but if you're going to leverage Calm, thank you, yes, Calm, another one, you have to have standout creative, but you don't have to pay for all of the space if you've got other people that will share your content. And there you've got, an absolutely, I'm a Norwich City fan, by the way, you might be able to tell, loyal following, particularly from certain demographics, not all demographics. So on suicide prevention, yes, think carefully about who you might want to partner with and think about who those partnerships will allow you and partners will allow you to reach. Our campaign wasn't a suicide prevention campaign, but the two go hand in hand. If you can't talk about stigma or seek help, or because of self-stigma, you're not going to look after your own mental health and well-being because you're not going to acknowledge that there's anything going on, then people will get worse and people won't go to services and people will feel suicidal. Obviously, there are many other factors driving suicide rates and, financial woes and cost of living crisis and marriage problems all related to that. So I wouldn't say I was a suicide prevention communications expert, but I think that some of the key approaches and some of the key tips, Russell shared some of them, and always always research with your potential future audience, just like you said, Russell, what's the problem? What are the barriers? And therefore your audience will give you the solutions. So you need to spend time with people that are directly affected by the issues. Please don't dream up campaigns. I'm sure no one does, but with a group of us comms people in an office, go and spend time with the audience you're seeking to influence. And there are many support groups where you can go and access networks of people who might have felt suicidal or, had attempts on their life or bereaved parents. So always work with your audience, test, like Russell said, work in partnerships so you can leverage reach and therefore impact, and, adjust your strategy rather than put all your eggs into a couple of big bursts. Keep learning, like Russell said, we're on a constant learning journey. Your creative might need to be refreshed. You might not be reaching certain audiences that you wanted to, so you need to review, like you did with Snapchat, Russell, whether you're reaching the audiences that you'd hoped to reach. But we always used to say, whatever your media budget or the reach your partners can bring, stand out creative that's tested with your audience, that is focused on behaviour change. Like with suicide prevention, you're talking about behaviour change. You're not talking about attitudes. I hope
Brilliant.
that's helpful.
That is very helpful. Thank you so much. And some of those suggestions of tactics, particularly speaking to people, were very pertinent, I think, to Ashley's question from Derbyshire, asking about, where would she start to do something like this to support families of people with dementia? Russell, have you had any experience in that field?
No, I've been involved with services who've done it, but not so much from a kind of communications campaign.
But from Sue's advice, it would seem like if there are support groups for families and people with dementia, starting there to talk to them and then thinking about long, always on type campaigns to gently build partnerships and so on around it could be the way to go. I'm just going to have a quick scan down for.
While you do that, John Paul, one thing I was asked to contribute to, we did a toolkit on Time to Change Global Toolkit on stigma with our 5 partners in Africa and India and people lived experience. I can send a PDF of that. It's no longer online. But as a result of that, somebody who's a great stigma researcher at UCL, they were developing a toolkit globally to address the stigma of dementia and Alzheimer's. I think was it the International Alzheimer's Society or something? Anyway, something like that. There was a global body and UCL stigma experts as well. And so that had some really good tips about how to approach addressing stigma of the issue of dementia, because quite a lot of the strategies are very, very similar for stigmatized health conditions, and Alzheimer's dementia is one of them. So there might be some tips to pick up from that.
Brilliant. And those could be applied, I'm sure, to Leanne's point about perimenopausal women and women's health plans as well in Scotland. That's fabulous. There's a comment there from Maria talking about how they've had outreach teams going and speaking to young people where they congregate. I think sometimes teams can be a little bit nervous about engaging young people, going out there and just speaking to them where they are. 2,000 responses. That is absolutely staggering around mental health related terms. Brilliant job there, Maria. And is there anything you'd like to share on top of that?
I just think it's just down to the team. I think they've been around for a while and they've got great relationship with some of the kids in some of the key areas, especially the kind of areas of deprivation where they particularly want to target like a holistic approach to look at what they want to see in their locality and stuff. And this obviously all impacts on mental health and worry about the future, worry for job, opportunities and everything. So they do a huge like holistic wraparound kind of approach to kind of engage with what it is, get their views and thoughts, which helps shape kind of, whilst even though we are, like with many councils, really struggling with resources and having to balance the budget and stuff, but this sort of thing I think is gold dust really, because it enables us to focus our resources to real positive outcomes.
Absolutely wonderful. And to hear the sort of hierarchy of things that are concerning that audience, it means that making messaging is going to be so much easier, and less, the testing will result better. Thank you so much for sharing, Maria. Alexia has shared free 20-minute online suicide prevention awareness training. That's brilliant, and it could be easily factored into any campaign about suicide prevention in the local area.
John Paul, can you just mention something? Russell, you talked about the tip is to work with behaviour change experts, is have a look at some of the models or talk to some of the people that use them. We kind of retrofitted in the early days, and then we continued to look at the COM-B model. But there's also the East model. There's another model that we're using with overseas territories that we're working with, where you take elements of the campaign and whether it's the motivational factors or the underlying capability or the tools, and things like having online training or booklets as well as campaigns. You've got to put all of these elements together, not just there's that, that's what I quite often see is, rather than a coordinated approach, thinking about a behaviour change model, which isn't that complicated, to be completely frank. The ex-head of social marketing from Time to Change works with me on contracts around the world, and she's got a master's in, but she makes it so simple. She's like, well, take this model, pick it apart, and we apply it to planning social marketing campaigns around the world now. So it's not scary and it's not rocket science. I'm sure most people are aware of them or using them, but take elements of them, even if you don't have the whole model. But don't have an intervention over there, a training bit, a toolkit, and then the campaign. You have to fit all of that together, because people can't act if they don't have the capacity or the knowledge. And obviously campaigns are part of that, but people will be needing things as well.
Yeah. And some people can get stuck as well on wanting to have the comprehensive plan at the beginning. But you're going to have conversations, try things, come back to people and have a feedback loop over a long period of time, which de-risks it and de-stresses it for all involved, and probably makes it a much more enjoyable process. Susie Evans has talked about speaking to families of people with dementia and how it really helped focus. So I think get over that maybe uncomfortable hurdle and speak to people, and then amplify and test. Please do take time to answer Russell's survey that he's just shared as well. I wanted to share a very quick example. This was also in London recently, targeting mental health with, oh, I'm not going to make the same mistake again. Hold on, I'm going to do it this way and do it like that. So this was a video created by South West London NHS.
Try to access the help early. It's all there. It's there for you. I do know that times are tough. The cost of living, financial burden, things are changing. People are much more anxious than previously. I know that based on a lot of the past treatment, you don't always feel comfortable about speaking to people about your issues that really worries you.
Conscious of time, but having the person that they might be speaking to or engaging with, very, very powerful and important, and then amplifying that to get thousands of interactions, reaching hundreds of thousands of people in quite a large population, but for a very small amount of money across Meta, but also news sites. You can't always rely on social media when you're targeting particularly slightly older groups. And you can see in there sites like the Times of India, all these ones ending .pl are Polish sites. So we're able to get these messages in front of communities for very low costs, and then to see which messages were working. And this data is really easy to get your hands on. We were also using search in this instance to find people who were looking, for depression and anxiety type symptoms. And one other partnership that I wanted to highlight that I thought was really powerful was when running cost of living activity, highlighting the help that was there. Tower Hamlets wove in mental health terms into the cost of living campaign, because cost of living being a driver of mental health, it's come up in the survey, it's come up in so many creatives. We know it's an issue, but collaborating between public health and the teams working on cost of living worked incredibly well, and managed to signpost people who might be struggling to help and support. Was there and there for them now. But I'm very, very conscious of time. Is there anything else anyone would like to ask in terms of a question? Russell, I'll hand back to you. Apologies, I've muted you. It's my fault.
No worries. Thank you everyone for coming. I mean, just a few kind of concluding points from me, and Sue or John Paul do chip in if there's anything I miss. I think I would say this, and it's come up, but that behavioural science approach for me is key. And if anyone wants any help with that, do reach out. I'll be happy to help signpost or help advise on that. I think a mix of, I think the beauty of Time to Change was that it wasn't just a kind of communications campaign. There was lots of work happening locally in the communities. So I think that mixture is something we can take. A good campaign based on behavioural science plus some outreach and engagement. It's difficult, but find some budget. If you find some budget, there are ways to make even a small budget go a very long way. Using influencers, your sports teams, your local sports teams, very, very helpful. John Paul's point just now around linking mental health and cost of living comms. Most of us are doing communications around cost of living. Tie in mental health where you can. Partnerships being key. Collaborate where you can. Don't start afresh. Don't duplicate what potential partners are doing. Work together. And I think that the real key one, Sue showed with the Time to Change campaign, you need to kind of be in it for the long run. These aren't behaviours that will change instantly. It's about, starting a long journey and continuing with it and trying to stick with it.
I couldn't agree more. I'm just showing some, we will, as people have asked in the thing, edit this video, put the presentation together. Sue's, because of the video, and it is an absolute monster, so we'll have to put it in a OneDrive file for you to get your hands on. We're also offering, as ever can, and particularly more interesting for the new people on the call, we can look and do search insight into mental health related terms in your location, which can help with messaging design and planning. And as ever, we're offering the free ad tech for council websites to help amplify campaigns for free. Thank you so much for joining us today. Thank you, Sue. That was absolutely brilliant and really inspiring. And thank you, Russell, for sharing what you have. Are there any other points before we go? Wonderful. Look forward to seeing you at the next event. When is the next event, Russell?
Thank you. Yeah. So the next event, watch this space for the next event, but it will be on Friday the 15th of March. Just checking that is Friday. Yeah, Friday the 15th of March at lunchtime. So we will be advertising that relatively soon. So thank you.
And if anybody wants to talk further, I'm on Twitter at Sue Baker TTC. I'm on LinkedIn, and I have my own website which will show you some of the campaigns from England and global, which is Changing Minds Globally. So you'll find me, and then there's a team that work on campaigns. So we're here if you want to talk. But thank you so much for the opportunity. Really appreciate it, and keep up your excellent work. You're the bedrock of our communications. Public sector workers, so really appreciate what you're all doing as well.
Thank you for sharing so much. If you do get the chance to answer Russell's survey, it's going to be really useful for you to help push back or push up to get time and resources for things like this. Those 3 prizes are there. The number of responses, I think, is around about 20 at the moment, so your chances of winning those prizes are actually very high if you take part. But yes, we look forward to seeing you at the next event. Thank you so much.